Well, Governor Newsom plans to end California's COVID-19 state of emergency at the end of February. Now, this timeline will give the healthcare system time to deal with any surges that may occur after the holidays. Joining me now is Stanford Clinical Professor of Medicine, Dr. Malathi Srinivasan. Doctor, do you think this is the right move, especially since we have some new variants and that we're heading into winter, or are we in a relatively good place?
Yeah, Liz, I think that we're learning to deal with COVID as a dangerous endemic virus like influenza, and waiting until February 28th gives us state time to see what the effects of our winter viral season is going to be like and see if any of the emerging COVID strains are as bad as the Delta was last year. Now, most of us are expecting an increase in hospitalizations as we move into cold and flu season, as more people get sick, not just from COVID Omicron, but also from influenza and RSV. Now, 2 years ago, the state of emergency gave the state authority to do a bunch of things, to access federal funds, mandate business closures and indoor masks, and importantly, let medical providers provide care by telehealth a lot more flexibly. The governor hasn't used any of the more restrictive emergency powers for quite a while, and the mandates recently mainly been used for coordinating vaccine sites and hospital capacity. So I think February is going to give us enough time to see what happens and hedge our bets to see if we need to walk back that decision.
Yeah, learning how to live with this virus, no question. All right, speaking of those variants, and there are a few of them, any in particular that you're concerned about right now?
Yeah, Liz, these Omicron variants are like a viral swarm, and they're already outcompeting BA5 by about 40%.
Wow.
And this includes BA 4.6, BQ1, BQ11, and XBB. It's like a alphanumeric soup of science. But what happened is that Omicron hit up against our better prepared immune system, and the virus began to mutate all over the world in the surface proteins, including the receptor binding domain where the virus attaches to the ACE2 receptor. So the good news is that the new variant seemed to cause a milder illness than Delta, kind of the same as BA4 and 5 over the summer. But the bad news is that it'll make a lot of our vaccines and antiviral treatment and monoclonal antibody treatment less effective over time, which is not good news for our immunocompromised community, and especially for those with high-risk features.
Speaking of those vaccines, Santa Clara County health officials recently announced that just 11% of its eligible population has received the new Omicron booster so far. How much protection could that provide against any of these newer variants? You said, it's kind of a wait and see sort of proposition. We're probably going to have another booster, it sounds like.
We probably will.
Yeah.
But I think that the bivalent boosters are going to provide some protection against the new variants because the majority of them that are circulating in the U.S. are derived from BA4 and BA5. And the bivalent mRNA vaccines make spike protein for Alpha, the original strain, and also for Omicron, BA4 and BA5. So it may protect a little bit less against the strain that's dominant in China right now, which is XBB. But that hasn't come to the U.S. because that was from BA2. But because the vaccine rates are low, the vaccines are going to protect individuals, but not really the community with herd immunity. Now, we do think that the vaccines are going to help prevent long COVID. With Delta, the study showed that long COVID was reduced by 15% based on a large cohort study, or about 50% based on a UK cell phone study. So it's unclear how much protection we'll get against Omicron since the illness is milder. But that's also in large part because the denominators aren't known. So I think we'll have some protection, but we probably won't have as much as we were hoping for, given the rapid rate of mutation.
Saying it protects potentially against long COVID, though, that's just been debilitating for so many people. I think that's reason enough for some people to go out and get the shot, no question.
Yeah, and I think anyone who's at high risk, anyone who's over 50, who's under 50 with high risk features from, asthma and diabetes, hypertension, obesity, chronic kidney disease, diabetes, immunocompromised, all of those people should definitely go out and get vaccinated. So the message is still the same. Please consider vaccination strongly, both for COVID and for influenza this season.
Dr. Malathi Srinivasan, thank you so much for joining us.
Thanks so much, Liz. Great to be back.